Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Stephanie Desmond, co-host of Public Health on Call. Today, guest host Shelley Hearn, director of the Lerner Center for Public Health Advocacy, speaks with Jamie Madriano, visiting associate professor with the Department of Environmental Health and Engineering at the Bloomberg School, whose research examines the health and equity impacts of environmental air pollution and weather climate stressors. Together, they discuss how health and cost implications must be tied to climate change policies, communications, and real community engagement. Let's listen.
Jamie, thank you for joining. I am so happy to talk to a fellow Jersey girl.
Thank you, Shelley. It's really great to be here talking with you too.
It's not just the Jersey thing, though I do think that for many people, that is part of your roots and why you understand environmental health issues, because it's a state that's had so many. But I do consider you my poster woman for what an environmental health professor should be. Hope you're okay with that.
That's very sweet. Thank you.
Well, part of it is you're an example of how you make public health real, and in particular, making sure that public health is part of that climate change equation. You are not just publishing esoteric articles, so you've got some good research out there. Your data is being structured so it actually helps policymakers make informed decisions. And it's factoring in health into all kinds of places, the built environment, energy, housing, transportation. You're embodying that climate health in all policies. And I really like the fact that you're creating those tools that bring an environmental justice into the metric world so you can actually be actionable. And that's what I want to talk about today, is making this real for public health, and what can researchers do so that they actually are plugging in to how policymakers can make decisions. And one of the things that I think is so cool that you've done, no pun intended, but it's the work that you did that helped and inform the New York City mayor's big heat adaptation program. They called it Cool Neighborhoods NYC, and it integrates some really interesting EPI methods. Can you talk a little bit about what that was all about and what got you into that? Let's make it real.
Yeah, no, definitely, Shelley. That's a project I'm really proud of, and it's an example of how I, seek to do all of my current work and future work. And I think there were a couple of things you said that really kind of hit home and are, the things we can think about when we're trying to bring public health into the conversation around climate change, climate adaptation, and mitigation. So it's sort of this one thing you mentioned about the structure of how we think of our projects and the data we're going to collect and analyze. We have to be thinking about those conversations right from the very beginning. How can we, collect data, arrange our teams in a way that's going to best be useful to people on the ground, policymakers, community-based advocates. And that really includes bringing those people in at the beginning of the conversation when we're thinking about the questions. So that's how we approached the project in New York City. Right from the start, I was working with the New York City Department of Health on that project. We worked very collaboratively all through the project. They took that work up to the New York City mayor's office, where it was, as you said, then incorporated into the mayor's plan, Cool Neighborhoods. And the mayor's office had a great team of people who were working directly with community-based organizations on the ground to help them understand and disseminate the results of that work, and to think about the types of programs that could really protect those people that were most at risk for heat-related illness and death.
Bravo. Seriously, it's just such common sense, but it's not what's happening, Jamie. And have you seen it picked up and replicated across the country?
more and more, I think we're seeing sort of academics come out of their towers and really engage with practitioners. As you know, we're doing a lot of that here at the Bloomberg School through the Bloomberg American Health Initiative. But there are efforts around the country doing that, engaging with policymakers, asking questions about what kind of data do you need? And also, so important, engaging with communities on the front lines. Just within my circle of environmentally focused public health researchers and epidemiologists, I see this more and more discussed. At conferences that really never touched on those things before, we're really seeing a lot more discussion about community engaged research and community based research. And I think it's conversations that are long overdue.
So you're not seeing it as radical conversation, but in fact is becoming more real and accepted, or is it still on the fringe?
I think that depends on who you talk to. But I think I've definitely, even in, my limited time if I look back on my career, I've definitely seen a progression in the people that I speak with and the researchers I engage with. So I think it is becoming more and more common. And I think, something that is a reality of research is that researchers are often looking for funding to do their work. And I think so importantly, we're starting to see funders that really value that as well and emphasizing that type of outreach and stakeholder engagement. And so, whatever the force may be that pushes that along, it's good overall.
All right. Well, hallelujah. It's happening. But we have been talking about climate change and the threats out there for decades. It's becoming more and more real. The good news is we've seen some major federal progress. A number of states have been tackling it. But I'm still struck, as much as there are now investments, more research, I still don't hear health as part of the general discussion. And what's your take on that, especially as a health researcher who's generating that information? But where is it? Why isn't it being kind of shouted from the mountaintops to everyone to really get how real these threats are?
Yeah, that's a great question. And as you can imagine, one that's kind of frustrating to me. But I think there are some reasons for it. And I think there are things we can do about it. Another one point, just though, before I get into that, of why it is so frustrating is we also know that communicating the health impacts of climate change really resonates with people. It resonates with the public. It resonates with people across the ideological spectrum. And it resonates with policymakers too, because they know their constituents are concerned about health impacts. So, not just from the perspective that it's a passion issue for me, but it's frustrating because I think we could change the conversation more if we talked more about health. That said, I think there are things we can do to change that conversation. And one thing within the public health community that I don't think we've been very good at is really thinking about what policymakers need to hear. A lot of times they need to hear dollars and cents. They need to be able to do a cost-benefit analysis on a particular policy or adaptation mechanism. And in public health, we've very often shied away from that. I mean, I can at least speak from the epidemiologic world. And I think in the climate and health world of research, that is something that we are really lacking. So I'm working on a study right now where we're trying to put more cost implications around the heat associated hospitalizations that we see happening in the country every year. And we're wrapping up those results now. And there have been some other studies that have put some numbers on things, and those costs are pretty enormous. But until we start to have that happening more regularly and really get that into the conversation, I think it leaves a big gap for policymakers and for people that need that kind of quantitative data to really be able to shift resources around.
It's a really good point. And I appreciate how much you're thinking about how do we create the, not just tools, but the data that matters to policymakers, not the data that just matters to the scientific world, but if we're going to be part of fostering change, what's the data that is going to drive that change? So you talk about cost benefit analysis. Give us something tangible that we can understand. So Hurricane Ian hit, devastating in Florida. And there were all kinds of numbers being associated, but numbers in terms of cost of rebuilding. And we got numbers on death, but I don't know, did you really hear about the health aspects of Hurricane Ian? What would it look like to you if we did?
Well, I didn't hear about them. Did you?
No, I didn't. But I did hear, Hurricane Ian, and it was in the past, it was the reinsurance industry that was one of the big industry drivers that we had to deal with climate because of how they were being hit economically. So if we put this in a health context, I mean, when we heard about the numbers of what Hurricane Ian cost us, was health in that equation?
I think I saw damage assessments around, in the $40 billion range. So it's going to depend on who was putting that number forward. But I can tell you typically in damage assessments, so we hear all the time about the $1 billion weather events. And those damage assessments usually do not include health costs associated with them. There's a lot of reasons for that, for many, it's difficult. Many of those types of events, it's very difficult to know the health impacts right away. It can often take a lot of time.
Yeah, but come on, they haven't done a count of how many buildings got knocked down. These are estimates.
Right.
And they are able to do indicators. So I'm sorry, it's not okay that when Hurricane Ian hit and we're saying $40 billion cost, that didn't include the cost to health because they're significant. Hurricane Ian, it wasn't just death.
No, exactly. It's not just death. It's going to be hospitalizations, and that's for so many reasons. There might be injuries that occur. There might be excess heart attacks that occur because of a storm like that. There's going to be issues around mold. And so, people who have asthma or other respiratory illnesses are going to suffer. They might go to the ED more frequently right in the aftermath of that. There's also going to be the mental distress with evacuation and flooding and all of those types of implications. And another really important thing to since we're talking about damage assessments and cost benefit analyses, this is a critical issue when it comes to equity as well. So if we think about damage assessments and property values, we know that those are always going to get weighed more to the higher value properties. When we think about sort of when communities are implementing flood control and mitigation, and if they want to direct resources to areas that might have the greatest potential to lose value because of the property. But on the flip side, it's not those high value properties that are generally going to suffer the worst health consequences or have the inability to recover afterwards. So, if we really start to factor in where are those health impacts occurring, who are they occurring to, and thinking about that in a more holistic way, we can also be incorporating issues of equity.
So maybe that links us back to, you raised the point that you are doing and you're seeing more community-based partnerships, community-sourced science, ways to build in stakeholder perspectives into your work, and you're seeing others doing this. Can you dig in a little bit more, just to give an example to the listeners? What works? Why does that matter? And why is it so important to be shifting in that direction?
Yeah, I'm really glad you got to that, because I think it also, it touches on what we need to do next. We talked a lot about in the beginning of the conversation, some of that heat vulnerability mapping I've and others have done in other places. I think of that as, the sort of the first generation of climate and health research, and where do we need to go now? And I think it's really important to be thinking about solutions. So not just pointing out the problem, but what are the ways we can do research to really, again, provide data to people on the most effective solutions. And so I think thinking about that is where we really need those community voices, because people know what will work for them and what will work in their neighborhood and what won't, and what will be accepted by their community and by residents, and how that might be implemented over the long term. So I can give you an example of a popular solution that we often talk about when we talk about heat stress and we talk about climate adaptation. We often talk about planting more trees and greening spaces, and thinking about parks and their use. And I've done some work over the last year or two with some organizations that work with community advocates on the ground across the country. We interviewed them about some of the solutions they're promoting for climate mitigation and adaptation. And what we heard over and over again from these folks was that, yes, they were promoting those kinds of solutions, greening of neighborhoods, and they were hearing from their residents fear, distrust, wondering how that was going to affect rental increases and where they were living. Were they going to get pushed out of their neighborhood? Were these solutions really meant for them, the people that have been living there for decades, or was it meant for the next people that were going to come in and push them out? So, what those groups have been now really working on is, again, thinking really holistically. And at the start of those conversations, not just talking about climate adaptation and greening, but talking about community land trusts and housing protections that need to happen. So again, it really kind of brings home the message of climate and health. It needs to be in all policies, as you said at the beginning of the conversation. All of those sectors, housing, planning, transportation, they all need to be at the table along with health and equity.
Jamie, I really appreciate that you're connecting the dots. You're seeing how this all meshes together to really address holistically climate, the health aspects of it, and that you're connecting this to an advocacy that we have got to be part of, helping those solutions become realistic, and paying attention to those, for some might have been unexpected consequences, but in fact, by listening to communities who know what could happen, it makes it for healthier solutions. And being an advocate for pulling that all together makes a difference. And particularly, you're calling out to those that you called it the tower, the academic tower. We need to all come on out and engage with communities, be hands-on, rolling up our sleeves and being the solvers. So thank you for helping do that. I hope to come back and we'll talk more on ways that others can integrate community-based research and advocacy into their work.
That would be great. Thank you so much, Shelley.
Thank you, Jamie.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.